Imagine a country deciding to give a health safety net to 500 million people and doing it almost overnight. It sounds impossible, right? Well, today, we're going to dive into one of the most ambitious healthcare projects on the entire planet. It's the story of how India is teaming up with thousands of private businesses to tackle a massive, massive human challenge.
I mean, think about that question for a second. How do you even begin to provide quality healthcare for 500 million people? This isn't just a policy puzzle. It's about real lives. How do you build a safety net that's big enough, strong enough to catch that many people? That's exactly the challenge India took on, and the way they're doing it is absolutely fascinating.
So let's set the stage here. To really get why this solution is such a big deal, you first have to understand the problem. For millions upon millions of families in India, one bad diagnosis, one unexpected surgery could mean complete financial ruin. It could push them into a cycle of debt they might never escape. So bridging that gap, well, that was the mission.
And here is the government's answer: Ayushman Bharat, or PMJAY. And listen, when we say this is the world's largest government-funded health scheme, that is not an exaggeration. It was designed from the get-go to be this massive undertaking with one really clear goal: to stop medical bills from becoming what they call catastrophic health expenditures. You know, the kind of bill that can just wipe out a family's entire life savings in one go.
So what does this protection actually look like on the ground? Well, it looks like this number: 5 lakh rupees. That's the amount of health coverage that every single eligible family gets per year. And we're talking about the big stuff here: serious hospital stays, major surgeries, specialized treatments, not just a trip to the doctor for a cold. This isn't just a number on a page, right? For millions, this is a real financial shield.
And who gets this shield? Well, the scheme is aimed squarely at the people who need it most. It targets the bottom 40% of India's population, based on their economic status. To put that in perspective, that's over 100 million families, which works out to about 500 million people. The whole idea is to get healthcare to those who were previously left behind.
Okay, so we've got this huge goal and some serious coverage to back it up. But the billion-dollar question is, how do you actually deliver it? I mean, you can't just snap your fingers and wish a giant nationwide healthcare network into existence. The answer, it turns out, was a really clever partnership.
You see, the government realized that its own public hospitals, even though there are a lot of them, just couldn't handle the sheer volume of patients, and they couldn't cover every single corner of the country. So to make this thing work, to make it truly accessible for everyone, everywhere, they knew they had to bring more players to the table. They had to tap into the entire healthcare system.
And this is where the private sector stepped up in a huge way. Check out this number: 15,733. That's how many private hospitals have been empanelled, which is just a fancy word for officially joining the Ayushman Bharat network to provide care. Just let that sink in. We're talking about thousands of private businesses partnering with the government for a massive public good.
And here's what that looks like visually. Private hospitals now make up 55%, the majority of the entire Ayushman Bharat hospital network. So they're not just participating on the sidelines, they are literally the backbone of the operation. This public-private split is the engine that's making this whole thing go, and it's massively expanding where patients can get treated all across the country.
So we have this gigantic network set up. But is it actually doing what it's supposed to do? Is it working? Well, let's look at what this collaboration has actually delivered, because the numbers are pretty mind-blowing. 3.8 crore. That's 38 million hospital admissions. Just wow. And remember, every single one of those isn't just a number in a database. It's a person. It's a family who got critical medical care, from heart surgery to cancer treatment, without having to worry about a life-destroying bill at the end of it. And what's the total value of all that care? A whopping 45,000 crore rupees. And again, this isn't just some abstract budget number. This represents the incredible financial scale of medical services that have been delivered through this network. It's a huge injection of funds going directly into treating patients.
All right, so let's just put all of that together for a second. When you see these numbers side by side, the whole picture just clicks into place. You've got more private hospitals in the network than public ones, and together they've enabled almost 40 million treatments. The key takeaway here isn't just one of these numbers, but how they all connect. This is what a healthcare revolution, powered by public-private collaboration, actually looks like. Okay, so let's zoom out. What does all of this really mean for the future of healthcare in India? Because what we're looking at is so much more than just an insurance scheme. It's a fundamental shift in how medical care is delivered to hundreds of millions of people.
You know, this quote really just hits the nail on the head. This partnership with the private sector isn't just some nice little add-on. It's the cornerstone of the entire program. Without the capacity, the reach, and the specialized treatments that thousands of private hospitals bring to the table, a scheme of this scale just wouldn't be possible. It's become a relationship where both sides are crucial, and it's defining a whole new era for Indian healthcare.
And that leaves us with one final, powerful question to think about. This model has proven it can unlock incredible access to hospital care. So as this massive partnership gets stronger and more efficient, what's the next big challenge it could tackle? Better diagnostics? Primary care for rural areas? Medical education? It really feels like a whole new blueprint for progress has been drawn, and it's going to be fascinating to see where it leads next.